Hello, my name is Niels Peek. I'm Professor of Health Informatics and I lead the Health and Care theme in Digital Futures. The theme focuses on the use of data and digital technologies to understand the causes of disease, to understand what progresses them, to develop new diagnostics, new therapies, to understand the complex interaction between health and the environment, and also to improve the health and care system. Broadly speaking, the activities in the theme can be divided into three clusters: algorithms, systems and people. The algorithms bit uses the fuel of digital technologies, data, to develop new algorithms that can help us to predict the disease status or health outcomes of individuals or populations. For instance, we develop algorithms that can predict whether patients with psoriasis would respond to biologic treatment. Biologic treatment is a new class of very expensive treatments that work very well in some individuals but not in others. If we can predict which patients will respond, that can save those who wouldn't respond undergoing the burden of the treatment, and it can save the NHS a lot of money. The second activity cluster, the systems cluster, brings these algorithms to clinical practice to make predictions for individuals in clinical practice. So in this cluster, for instance, we develop apps that doctors can use to make predictions for their patients as they see them. In the cluster, we engage, for instance, with hospitals and help them to implement these apps. And by doing so, we create what we call a learning health system, because the data on which the algorithms were based in the first place were also collected in clinical practice. So essentially, we've created an NHS that learns from its own data and improves clinical practice as we go along. The third activity cluster doesn't look at systems, but at people, individuals. So in this cluster, we focus on the digital technologies that people use in their everyday lives, like smartphones, laptops, wearable sensors, digital weighing scales at their homes, etc. And again, data and algorithms are the fuel. But this time, we use the technology to help individuals to manage their own health better. So one example of this is that we have developed apps that can help patients with mental health conditions to track their symptoms over time. And this helps them to better understand their condition, and it also helps mental health researchers to understand these conditions in general. So as you can see, our understanding of such long-term conditions is now rapidly improving through these digital technologies, because we can measure things, not just in the clinic, but in everyday life. Of course, we're not doing this alone. We work together with, for instance, the other themes in Digital Futures. We also work together with local, regional, national and international organizations. For instance, we work together with Health Innovation Manchester, with the regional NHS, with the Greater Manchester Health and Social Care Partnership, with the Alan Turing Institute, with the New Mind Network and many other organizations.